Hello friends, today we're going to discuss about taking care of aging parents. I'm Dr. Suresh Badadmat, Professor of Psychiatry, working at Nimans, Bangalore. In this video, I'll be discussing about taking care of aging parents, that is, being caregiver. What is the impact of caregiving? What are the important factors which play a role in caregiving and how to manage stress because of caregiving? Let's understand what is caregiver. A caregiver is defined as a person who attends to the need of a dependent. It may be disabled, it may be a child or adult or aging population. In this video, I'm focusing on aging parents. But at the same time, one more important definition we need to understand, that is care recipient or receiver. One who receives care, an individual with a health condition or disabled or who requires support with various activities of daily living. Caregivers manage the physical, emotional, spiritual, and practical needs of another person, that is, care receiver. Caregiving can be financially, it can be emotionally, physically, or else on the logistics on day-to-day events. Actually, caregiving is a public health issue for both care provider and a receiver because it affects both of them seriously and as a community at large. Approximately 20 to 25% of the adults are caregivers at any given point of time. Caregivers play multiple roles while providing care. Let's understand by some of the examples. The care receivers, such as persons with mental illness, persons with serious physical illness who have been injured, maybe fracture, or persons with disability, dementia and chronic neurological conditions, geriatric and aging parents, persons suffering from serious illness, cancer patients, children with serious illness. So these are the care receivers or the people who require to be assisted in their life during their illness or disability. Usually who are the care providers? Invariably in India, the family members are the most common caregivers. And the next is relatives, friends, children. Paid attendants are now increasing slowly. Paid professionals, non-governmental organization, community volunteers and others are in the line in care providers. Now let's understand what are the role and responsibility played by the caregivers. Actually, this is based on the needs of the care receiver. So let's look into some of them. The first and the foremost is household chorus. That means the person is sick, bedridden, is unable to buy things, or else is unable to take care of the house. So those kind of household chorus will be taken care by the care provider. Driving around, that means the person requires assistance to travel or transportation. Sometimes it is just an emotional support. Physical support, cooking, cleaning, gardening the house, those are the issues. Sometimes security. That means some person needs to be with the person so that there is a security and safety of the elderly person. Activities of daily living such as brushing, bathing, toilet, dressing, having food. So these kinds of assistance are also is required in seriously injured person. Family related issues such as supporting the young children of the person who is care receiving, their reserve and children's schooling, resolving conflicts within the family. So those are the other responsibilities the caregiver has to give. Sometimes the caregiver has to move further, such as rehabilitation care, such as exercises, physiotherapy, cognitive retraining, breathing exercise, yoga. Those are the things sometimes caregiver are expected. Medical care, medications, giving in time, injections, monitoring BP and sugar, buying medicines, giving medicines, wound care, taking them to the hospital, doctor's appointments. So these medical related also may be required for the person who is receiving care. And one of the most controversial is financial and business related. Imagine a elderly person who has lot of wealth. Somebody has to manage it now. So this is where the caregiver have to now look into the aspects of financial and business related. There are many people who would like to come and provide assistance for financial issues, especially for taking care of the care receiver's money. But however, invariably it is attached with malintentions or malified intention. So that's we have to be very careful with this issue. Buying household things, groceries, which I already mentioned, arranging events. Imagine birthday event of the care receiver, or else family function, or else mixture of the above roles and responsibilities. So these are the roles and responsibilities which the caregiver will provide to the care receiver. Now let's understand caregiving. Actually, it is a life-changing event. If you look at from the caregiver's words, that means what do they say? One of the most impactful sentences, it effectively changes your life, your priorities changes, your lifestyle changes, your attitude to the person you are giving care to changes, and your role changes. That means there is a dimensional shift, or else paradigm shift in your life occurs, which occurs sometimes unexpectedly. That means you are planning for a career, or else for an occupation, or else promotion, and suddenly you come to know your father is ill. You need to provide care, and that care may be 1 to 2 years or 5 to 10 years, and this will come in your way of your planning. Hence, it is life changing, and you need to be ready with those changes. So, caregiving is tailored. That means one size does not fit for all caregiving purposes. This changes across the population and across time in same population. The best example I can give you is dementia. In the mild dementia, the caregiving will be just supporting them and prompting them. Over a period of time, when they shift into moderate dementia, that means you need to help them in ideal activities, that is, activities of daily living. When they go into severe dementia, you may have to take assistance from the professionals to provide care. That means in the same population, the caregiving changes from day to day. That means one size does not fit for all. And for the same person over a period of time, again the caregiving changes. We need to be ready. We need to plan as per the tailoring of that person. That means caregiving has to be tailored for the needs of the care receiver. Now let's understand the type of caregiving. Invariably, who is the caregiver on that basis? Whether the family member is the caregiver or the non family member. The next one is paid versus non paid caregiver, or else formal versus informal. Formal means it is a paid, arranged per month, and informal is it is just for the voluntariness the person providing. Trained versus non trained. The person who is professionally trained will be providing the caregiving, whereas non trained is again maybe either a family member or somebody else. Professional versus non professional. Continuous versus episodic. Continuous means the assistance is required only for driving, or assistance is required only to go to the hospital, or else for providing injections. So, again, the caregiving based upon how much it is required. State sponsored versus private, whether the caregiving is given by the government or else non governmental agencies. So, these are the various types of caregiving given as per the person who's providing. Now, depending upon the environment where the caregiving is made, whether the caregiving is occurring at the home of the care receiver, that is in the community, whether it is in the hospital, whether it is in the halfway home, whether it is in the long stay home, sheltered accommodation, supported accommodation, assisted living facilities, nursing homes, adult daycare centers. That means based upon the shelter, it can also be classified. Please remember this. Caregiving is universal. There are four kinds of people in the world: those who have been already caregivers, those who are currently caregivers, those who will be caregivers, and those who will be needing caregiving. That means it is a 360 degree of care from already given, currently giving, who is going to be giving, and who is receiving. So that's very essential. Nobody is spared of caregiving. Good qualities of the caregivers. What should be those qualities which should be imbibed in a person who is providing caregiving? First and the foremost is compassion. It is not only empathizing, he needs to move to help them, or else he feels that he needs to do something for them. Patience, being kind to them, attentive for the needs of the care receiver, dependable and trustworthy. He should be counselor because the care receiver also feels guilty for putting the caregiver in an uncomfortable situation. And the care receivers may also feel guilty of being dependent on somebody and they may go into depression. Having humor, excellent communication skills, cooperative, assertive, and physical strength. Why is this assertive is there? Assertive is he should slowly try to make the care receiver to be independent. So he has to assertively say, yes, this you can do. Yes, in this area, I'll be assisting you. Physical strength. Here, it is not only the mental strength, the physical strength to carry the care receiver, to shift him, to give him bath, or else various other activities. Knowing the limitation, the caregiver should know how much he can move or how much he can go to help the person. And the caregiver also should seek help. He should be physically fit, mentally fit, able to deal with the caregiver stress is very important. That is compassion for fatigue, what we call sometimes are seen in a first responder for emergency. Similarly, some of the caregivers may have this, willing to learn new skills depending upon the person's need. Detailed orientation should be there. That means he should focus on small events so that those information can be given to the doctors or for the physiatrist to do rehabilitation. And they should have a good observation skills. They should be trained in first aid. Passion for the job is essential. Here, a very good quote is, we can teach the skills of the job. You cannot train a person in passion. If you are passionate about caregiving, please enter into the field. Otherwise, stay away from it. Although you may be forced to become a caregiver and also care receiver, it is left to the nature or the God. Ethics and professionalism should be at the topmost when you are providing caregiving. Now let's understand the resilience. Some caregivers will do this activity of providing caregiving with happiness, joy, and resilience. The most common factors which are very essential for a caregiver to be resilient is communication and social support. Some of the studies have said family support and religious background of the caregiver plays a crucial role. Sometimes the caregiver requiring cognitive behavioral therapy, problem solving skills, coping skills, and also counseling skills improves the resilience of the caregivers. At this point of time, resilience is under research, not only with the caregivers, but also the person who is undergoing or receiving the care. Now let's understand the impact of caregiving. What will be the physical, emotional, mental, psychological, and financial impact of caregiving? First and the foremost, the caregiving comes with a huge cost. The care receiver is not earning. At the same time, the care provider has to quit the job, or else he may have to cut down his occupational work, or he may not think of going for higher promotion. At the same time, job related issue. At home there is a stress, at the same time job stress. Handling two kind of stress will be difficult for many people. Interpersonal or relationship also plays a crucial role in caregiving. Emotional issues. Burnout during caregiving is very high. Sometimes some people will become over involved during caregiving and they lose their life. That means they do not have any personal identity. Delay in life milestones. That means caregiving comes in the way of marriage. The person says, my father or mother is ill. I can't now accept to marry or else having a child. They say we can't bring one more person whom we have to take care, refusing promotion or doing higher education or anything. So that kind of milestones will be delayed when you are providing caregiving. So these are the impacts which are well known. But however, the emotional impact of caregiving is like a roller coaster ride. It is overwhelming, sometimes incapacitating the person who is providing caregiving. Caregiving can be emotionally overwhelming, as I mentioned. Usually, it starts with anticipation of grief. That means my father may die. He is now diagnosed to be having diabetes and hypertension. Or else, my father is having cancer. He may die anytime. So that anticipation of grief will set in as soon as the information is given. Sometimes there will be a grief. He will accept, yes, my mom is suffering from final stage of cancer. The grief sets in. Sometimes the person continues to suffer and the caregiver will be thinking how long this will last, whether why not my father dies early. Till when? That question frustrates them. That means uncertainty is the mother of all frustration. So many of the caregiver will have this question: how long my father or mother has to suffer? How long I also have to suffer in providing care? So these kinds of thoughts starts coming to their mind, and many a time they feel guilty of thinking killing their father or mother, thinking wish they were dead, and sometimes they cry, how can I think like this? So these kinds of things of emotional turmoil is very huge. As soon as they receive bad news of their parents having dementia or cancer or myocardial infarction, heart disease, liver disease, kidney disease, name them. Like geriatric or elderly population will have one or the other health problems which are chronic in nature. Maybe arthritis, maybe they require total hip replacement or knee replacement surgery. So immediately they go through these various stages of grief. First and the foremost is shock and denial. This cannot happen to me. And they will be denying, no, 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 this is not possible at all. Then anger. My father is drinking. How can he do this? So you'll be angry with the person who is suffering, bargaining. This cannot happen to me. Oh, this can happen to me also. And then depression and finally acceptance. So this is the cycle of grief given by Kubler Ross. This is a classical way, but however, depending upon the anticipation of grief, depending upon the nature of the grief or the issue, the mixture of this cycle goes through. Let's understand the Kubler Ross, what he said. The Kubler Ross clearly said that as soon as there is an emotion, you can see there is an emotion in the x axis and in the y axis, the duration. As soon as there is an event which is maybe affecting the family members or the loved ones, then there will be a shock and denial. Emotions will rise up, and then there will be anger towards the person or towards the society or towards the hospital, or else to any person it may be directed. That means the anger is turned outside. Later, the anger starts bargaining towards the outside, towards the inside. That means he will now feel depressed that he needs to, the anger is turned inwards. That is depression, and finally the acceptance. This is the classical grief phase. This grief will last for usually 2 to 4 weeks, and invariably it will resolve. This happens in most of the time, 70 to 80%, it goes through this usual phase. But however, the people may require help during anger, bargain, depression phase. That is the time people require some assistance. It can be non-professional assistance by the family members and friends is more than enough. But however, there are 20 to 30% may require professional help. Let's understand that people who require professional help. This is what is the commonest grief. And now we will see exploding grief. Suddenly, A person has been diagnosed to have stroke. The family, the person who is supposed to give caregiving, will have an exploding grief. He feels that let me also commit suicide. So that exploding grief is one of the commonest. Second one is there is absent grief. There may be many reasons. The person may not like the caregiver may not like the person who is going to receive the care. There will be absent grief, complete absence, delayed grief. The grief sets in after 2 to 3 weeks down the line. That is another common thing. And finally, protracted grief. If the person is suffering from cancer and he is on treatment and the treatment lasts for 1 to 2 years or 3 years, here the anticipation grief will be there and protracted grief continues. And there are other types, oscillating grief. Again, this is common especially in chronic illness. And further, once the grief sets in, there is one more important thing we should understand. The caregiver will go through anxiety, panic attacks, fear of losing the person who is suffering, hopelessness, become angry towards God, towards himself, towards the person who is receiving care, that is regard towards the parents, praying, spirituality, taking refuge under various religious institutions, magical thinking, and various coping skills will be employed to deal with the emotional stress. If this continues for a long period of time, maybe months to years, it will move into the third stage. That is the difficult stage. Here, lack of appreciation. That means he is devoting his time towards the care receiver, but nobody is appreciating his sacrifice. He will feel disgust, he will feel embarrassed. Frustration, being uncomfortable, and turmoil is the commonest phenomena seen in the long-term caregiving phenomena. With the wish the loved ones will be died. Tomorrow wish his father is died. And he may say that wish my father's pain ends early. So these kinds of discussion will start in and also kicks in with guilty. When does it going to be end? Is there an end to it or not? Feeling guilty about thinking about such things. Being cranky, having boredom, depression, loneliness, isolation, and crying to spell sometimes suicidal attempts also has been seen. Usually these emotions occur in random based upon the onset of the event, whether it is a stroke, whether it is a dementia which is slowly increasing, or else it is Parkinsonism, or else it is a cancer, and the circumstances, how this episode occurred, and then how much support and duration of caregiving, all these matters importance in emotional roller coaster ride. But however, please remember, never abandon the hands that raised you. Please think about this. This is a privilege given to serve your parents. This is the privilege given to you to pay back what the parents have done to you. Only few people get this privilege. Not everyone has this privilege to serve their parents. Now it is your turn. Think differently. Don't think they are the burden. If you think they are the burden, tomorrow you will be the burden for your children. That's not the way. The life is about paying gratitude. The mother of all emotion is gratitude. Feeling gratitude and at the same time, never abandoning the hands that raised us. Factor associated with negative impact on caregivers. What are those factors which impacts the caregiver seriously? Nature of onset, whether it is sudden or else whether it is slowly lasting for long duration, that is maybe 5 to 10 years, especially in dementia. Duration of caregiving and the quality of caregiving, is its severity that he needs to be there for every minute to provide care. Poor financial support, there is no financial aid at all. Severe disability of the care receiver. Types of caregiving, is it getting around, driving them, appointment, activities of daily living, grooming, feeding them, giving bath, financial assistance. Stigma and discrimination associated with that illness. Imagine if you are providing care for an autism or else schizophrenia or else dementia, what does the society will think? My father is having schizophrenia. How can I accept in front of everyone? So this stigma and discrimination also play a role. and anticipated loss, how much you are attached to the person who is suffering. Outcome of the caregiver. Imagine if it is a dementia, stroke, OCD, where there is no outcome at all. The outcome is a death. Again, the frustration starts. How much support system you are having? Awareness about the illness. You know that the person is not behaving deliberately. It is the illness what it is making them to do this. Cognitive blocks, cognitive distortion. That means if I do caregive, that means I should become all right. That is not the case. That means he may also die. Poor premorbid relationship with the caregiver and the care receiver. That means before this illness occurred, both of them used to fight like cats and dogs. Now the caregiver has to sacrifice himself or herself to provide care to the care receiver. Number of people involved in the care. And if there is no light at the end of the tunnel, that means by providing care, if that person is going to be all right, then you will be having clear that next 6 months I have to provide care. After 6 months, I am free. But in certain illness, there is no end to it. Uncertainty will put the frustration on the bay at every moment. So factor associated is one of the important thing is learning to handle the behaviors or problematic behavior. There are two types of problematic behavior which the caregiver is constantly worried. One is excessive behavior, another one is deficit behavior. What is this excessive behavior? Imagine the person had stroke, or else the person had mental illness, or else the person having dementia is shouting it loud. What will be the neighbors thinking? Or else this person is restless, running away from the home, pacing up and down in the home, slow in all activities. He takes 2 hours to eat. Perseveration, repeating the same thing 100 times, becoming violent towards everyone, talking to self, shouting at people, scolding everyone, delusions, hallucinations, accusing people of stealing things. And he feels the caregiver is trying to harm him. He feels that the caregiver is poisoning his food. Inappropriate sexual advance, disinhibition, removing clothes, running away naked outside the house, problematic bowel and bladder habits, passing stool in the clothes, passing stool in the middle of the house, in the veranda, or it may be in the living room or in the kitchen, wandering behavior. Such type of behavior will wear out the caregiver very fast. Deficit behavior also is known. If the care receiver becomes withdrawn, refusing to eat, refusing to take bath, refusing to take medication, or not doing any exercise, poor dietary control, suicidal attempts, asocialization, these kinds of deficit behavior also will add stress to the caregiver. Now let's understand recognizing the caregiver stress. Suppose somebody is providing care to their parents, then we need to teach them how to recognize they are in stress. If the caregiver feels tired, exhausted, within few hours he feels that he has done the whole day's work, feeling sad, feeling guilty, crying to self, withdrawn behavior, not mingling with anyone, insomnia, unable to sleep, irritable, angry, having panic attacks whenever there is a call from the father, death wishes, suicidal ideas, suicidal attempts, drug abuse, alcohol use, loss of empathy and sympathy, numbness, becoming irritable with the care receiver, shouting at the care receiver, sometimes physical abuse towards the care receiver, anxiety symptoms, panic attacks, feeling that anytime anything can go wrong, what will happen to me? Multiple aches and pains. At times, poor self care of the caregiver indicates that he is going through severe turmoil or stress. Now, let's understand how to deal with the caregiver stress. First and the foremost, the caregiver should know about the illness what the care receiver is going through. To know about this, he needs to seek help from the professionals. He should talk to the doctors. He should go and search website, take some good books, read about it, watch YouTube videos, and see about how to provide care to the person who is suffering from that illness. seeking professional help, seeking help from the family members, sibs, and the care receivers, brothers and sister, getting help from the friends, taking help from the NGO, self-help groups, caregiver support groups are available in various cities. So those kinds of seeking help is very essential. Anticipating challenges in near future. Yes, this may happen. Preparing or planning for the crisis. Yes, be ready. Yes, this will happen. I will move and I will do this. Undergoing training in providing care to the care receiver. Learning new skills to providing care at home, because financial issue is one of the most common. Hence, providing care at home will decrease the financial burden. At the same time, human rights violation and change in the environment will be very minimal, so the care receiver will be at calm in the known environment. Care receiver's agreement with the care arrangement is very essential. That means that person also will should be agreeing, yes, I will be in the hospital, or I will be in the ICU, or I will be in a long term home, making changes in the building or in the vehicle or in the bathroom and toilets. That means you need to put anti-skid tiles, providing rails, removing all floor mattresses so that they do not tumble down and fall. At the same time, making certain changes within the house, putting big clock, putting signages. At the same time, making sure whenever the aged person walks around, somebody is there, a bright light is put up everywhere, so that the person, the elderly person, does not have difficulty in seeing things. Cognitive restructuring by yourself. Yes, this is an honor to serve my parents. That kind of cognitive structuring should be done. Daycare centers and long care centers placement can be considered if it is becoming too much. Short term nursing home admission. This is for timeout. Imagine you have to go for an important conference or an event. Short time admission should be considered. Do not sacrifice personal life. Yes, of course, in India that do happen, sacrificing personal life, but it should be balanced. Know your limitations about providing care, accept it, because you are a human being, you are not a god. And permission to feel emotions. Sometimes you feel angry, yes, it is worth. If you becoming guilty, yes, it is possible. Accept it. This is the spectrum of emotion, but your behavior should not be with the emotion. That means if you become angry, don't hit the person who is receiving care. Do not shout at your care receiver. You have all the right to feel the emotion, but you do not have any right having that behavior towards the care receiver. That you need to understand. You have a permission to feel emotions, but you don't have a permission to be rude to the care receiver. That's what I meant. That is means permission to feel emotions is allowed, but not the behavior. Attending social function, don't avoid social function. Maintain work, family, and caregiving life balance. We have known only work and home balance, but now caregiving is also one of the balance you need to maintain. Take advantage of the technology. Use CCTV, GPS, telemedicine, work from home. Many a time, your caregiving towards the parents may require professional help. You can do telemedicine. You can know the doctor, call them, ask for help, ask to get the ambulance, have a healthy lifestyle. You need to exercise daily basis. You need to go for walking. Getting good sleep is very, very essential. Deal with your grief as and when the anticipation of grief occurs. Emotions. Deal with your emotions by doing meditation. Yoga is very essential. Talk to someone, especially to your friends. If you do not have good friends, take help from the professionals. Seek professional help when your depression and grief becomes more or overwhelming and you feel suicidal. Please take help. Learn to manage behavioral problems of the care receiver. Take help from the professionals. Talk to the doctor about the behavioral problems. Remember, it is not the person who is behaving. It is the illness what they are going through is making them to behave like that. So don't become angry with that person. Learn to deal the illness. Stop blaming yourself or the care receiver. Look for burnout symptoms, take appropriate measures, take insurance coverage for yourself or to the care receiver. If there are any income tax benefit for providing care to your aged parents, take that benefit. And also, if there are any disability benefit towards your parents and you want to take that, please utilize that. Check for the welfare measures in your state, contact welfare officers, see is there any way state can help you. Dividing and sharing of responsibilities with your family members and friends is also advocated. Get financial support if you find it very difficult alone to provide care. Hiring professionals, paramedics, trained professionals. You can hire 24 bar 7 nurse or else a helper who will be helping you to provide care to the family member. Yoga, spirituality, and have a realistic goals. Yes, this is the best I can do. And this is what any human being can do to their parents. Don't just abandon them. Taking religious institutional support. Many a time, many institutions are providing support to the caregivers, regular follow up and medications. Don't stop the medications. Take the opinion of the doctors. Learning to let go. That is mindfulness. If you're going through grief, it is a normal process. Please go through the grief. Don't avoid your emotions. Discuss with your family members and friends. And please understand there will be a problem in everybody's life. There are two answers to this. One is for a problem, there is an answer. Why to worry? Go towards the answer. Yes, there is a problem, there is no answer. Accept it. Deal with your emotions. Hence, it is called as problem focused answering, or else there is no answer. Deal the problem emotionally. So, now the question is why we should be a caregiver? Why caregiving? It is a sense of accomplishment to many of the people. Yes, I'm doing something. I'm doing something to my parents. I'm doing something to the community. Finding meaning in life. Yes, I'm helpful. Many people respect me. There are people for whom I am the world. That means think about that feeling. You are worth of a world for some people. Helping self by helping others. You want to feel worth? Help others. They will tell you are the God to them. That means you are elevated from no one to being a God. Strengthening relationship. If you provide care to your family member with whom the relationship has been spoiled, by providing caregiving, the relationship takes 180-degree turn. Gratitude. That means the God has given an opportunity to serve your parents. Satisfaction in life, giving back something to the community, rehabilitating the person, and many people feel that it is serving the God. That's what is providing caregiving. Now, let's understand from the public health challenges. What do you mean by that? Let's look into that. Indian population is somewhere around 140 crore. The median age of Indian population is 28.4 years. That means majority of the Indian population is around third decade. But in next 2 to 3 decades, this will change. We are going to have many people who are in a geriatric population. That means we should have an army to provide care to our senior citizens. Not only that, there is disability is increasing, aged population will increase, mental health issues, road traffic accidents, cardiovascular accidents, carcinoma, chronic illness. That means we have to provide caregiving to many people. That will be a public health issue in next 2 to 3 years. That means we need to start working towards it. How to provide care to the elderly population in next 2 to 3 decades. The increasing number of care dependent people leads to a high economic burden on the healthcare cost, also onto the community. Hence, we need to understand the outpatient before inpatient applies to all chronic illness. What does it mean? Provide care at home. Provide care in the house where the care receiver is there. Best example is COVID. In the first wave and second wave of COVID, all the COVID positive were admitted in a hospital. Within no time, there were no beds. Everybody was running towards getting the bed. There were no beds. So in the third wave, we learned we can provide care at home. Similarly here, all chronic illnesses, 90% of them can be provided care in the community at home. That means you have to train the people in the community. We need to empower the community to provide care for their family members. That means formal versus informal. Informal is training your family members, providing care to the elderly. The growing demand for nursing care and the lack of qualified caregivers requires further strengthening outpatient and community care structures within the society. That means we will not have so many nurses to provide care one-on-one. The only answer is the family members. We need to train the family members. So we have to come up with innovative model of training and recognizing the informal caregiving model, which is very economical, human rights based, and comfortable to the person who is receiving the care. That means empowering the community, empowering the family members, providing the care within the family is the answer. Hence, the time has come. We need to do task shifting and task sharing. By maybe the nurses can be the best people to do this. That means the nurses will be able to train the army of family members to provide care to their aging parents. That's what it is meant. That means we cannot just have only nurses to provide care. It is the family member who can provide the care. Hence, we need to train them. So to train them, the nurses are the best. So there is a tough decision ahead for our Indian population. One need to make hard choices when providing care to the aging parents. To conclude, my dear friends, caregiving is a public health issue. We are going to have a huge number of people who requires caregiving. That means within next 2 to 3 decades, our mean age of our population will shift towards the senior citizen. We need to have an army of people providing care to them. Hence, we need to build a caregiving qualities in our children. It is my duty, your duty, and a collective duty of the society. That means we need to have a trained manpower to look after the needy family members. Caregiving is a highly strenuous job and requires training and managing stress because caregiving is overwhelming. Sometimes burnout, depression, suicidal ideas are very common. There is an urgent need to develop an army of caregivers to prepare for the future demands in our society at this point of time. We have 2 to 3 decades now. If we prepare now, we will be able to handle the stress with ease. This can be done by providing training through task shifting and task sharing so that our family members and children learn how to provide care to the senior citizens, to the disabled, to the persons with mental illness, through innovative training mechanisms by using digital technology and employing nurses to train the caregivers is an essential step in empowering our community, taking care of themselves, and that is the answer in our public health issue of caregiving. Finally, my dear friends, to care for those who once cared for us is one of the highest honors. That is, having gratitude and providing caregiving to our aged parents is the highest honor which the God has bestowed on us. Thank you very much for giving your valuable time. Stay safe.